Recording, creating culture of safety. Module 1 objectives. By the end of this module, you should be able to describe the interventions to prevent falls within the healthcare facility, describe the safety hazards within the home environment and interventions to prevent injuries, and describe the current use of patient restraints, and then describe the hazards to healthcare workers and the interventions to prevent injuries. The importance of safety. Accidental or unintentional injuries are the fifth leading cause of deaths in the U.S. Approximately 26 million people a year received injuries that disabled them beyond the day of injury. Motor vehicle accidents are number one cause of accidental deaths, which are followed by poisonings, falls, chokings, fires, and drownings. Healthcare organizations that really work on the safer patient care are the Joint Commission, Safety for Staff and Patients, the Institute of Medicine, or IOM, wrote up a white paper on To Err is Human, Building a Safer Healthcare System, going through showing what we need to do to make sure that we do have a safer system. American Nurses Association does research on patient safety and staff safety, quality and safety education for nurses, which they call CUSN, and then Medicare has their own CMS standards. For developmental factors in the infant and toddler, motor vehicle accidents are the leading cause of death for children aged to 3. And just remember that most time motor vehicle accidents are considered accidental deaths. They can also have falls, choking, SIDS, drowning, and then ingesting poisons are other concerns. Also make sure that gyms and mobiles, they should be removed from cribs by 4 months old to prevent choking or strangulation. And then you want to make sure that their mattresses are firm so you don't have any fear of suffocation. School age children, again, motor vehicle accidents, the leading cause of accidental death, and falls are the leading cause of non fatal injury. Most of that is due to lack of protective equipment like their shin guards, bike helmets, etc. Adolescent, again, the motor vehicle accident is the leading cause of death, which is followed by homicides. With an adult, you have unintentional poisoning causes more deaths than motor vehicle accidents. Again, like I was talking about, especially like alcohol poisoning. And then 20 to 40-year-olds, top priority for safety is automobile crashes. In the older adult, physiological changes increase risk for falls, burns, car accidents, and other injuries. And falls are the most common cause of accidental deaths for adults in the age 65 and plus. And then you also have to look at different type of medications which put them at a fall risk, especially ones that have side effects of orthostatic hypotension, dizziness, or drowsiness. Safety hazards in the home, poisoning. Death rates have tripled in the last 20 years. Carbon monoxide exposure, we need to make sure that they're being monitored annually in the home setting. There's scalds and burns, fires. Older adults and children under 5 are at greatest risk for fire injuries. We talked about firearms, suffocation and asphyxiation, which is the leading cause of death of infants below a year. And then you can actually be bringing home toxins um, from the workplace. Falls are the third leading cause of injury related deaths. 4 out of 100 people experience non fatal falls, and this rate triples for adults above 75 years old. More than half of them occur in the home, and 80% of the falls in the home involve people that are older than 65. Part of the reasons are poor vision, hypotension, histories of falls, dizziness, pain, alcohol use. They could have cognitive impairments, polypharmacy, or what we know is multiple medications, Could be because they have arthritis, or they have that should be gait and balance deficits, and age above 80. Safety and food poisoning, we should always make sure we're educating our patient, and education should include that immunocompromised individuals are at risk for complications from food poisoning. Clients who are at risk should eat and drink only pasteurized milk, yogurt, cheese, or other dairy products, and that handling raw and fresh food separately, um, to make sure that we avoid cross contamination, can help also prevent food poisoning. Talking about safety hazards in the healthcare facility, we have the never events, healthcare acquired complications that can cause serious injury or death to a patient that should never happen. The examples are foreign objects left in patients after surgery, air embolism, medication error, giving the wrong blood, severe pressure ulcers, falls and trauma, IV catheter infections, surgical site infections, DVT or PE post op. Um, you have the UTI, and then you have the VAP. Sentinel event is an unexpected occurrence involving death or serious physical or psychological injury or the risk thereof. This serious injury includes loss of limb or function. The phrase or the risk thereof includes any process variation for which a recurrence would carry a significant chance of a serious adverse outcome. And they're called sentinel because they signal the need for immediate investigation and response. There's equipment related accidents like suction devices, IV pumps, oxygen cylinders, wheelchairs, beds. You can have fire and electrical hazards, biological hazards. There's also mercury exposure, and someone that is exposed to mercury, you want to watch for symptoms of chest pain, pneumonitis, and inflammation of the mouth. Falls in the healthcare, most commonly reported incident in the hospital and long-term care facilities. 1 out of every 2,000 patients. They're at risk because of poor vision, cognitive impairment, difficulty with walking balance. We talked about orthostatic hypotension, weakness, dizziness, or drowsiness. And the greatest incidence is they're having falls from bed, more common on nights, weekends, and holidays. For assessment for falls, we want to do our initial assessment, and then we want to do a risk for falls assessment every 8 hours after that. So Q shift. We want to identify any medications they may be on that would make them at a increase for falls. You want to do a Morse fall code scale on them, a get up and go test, and you can also do a comprehensive fall evaluation if you feel that they are at a risk. Home safety, we want to make sure that we're going through a checklist to let the clients know what we're identifying as potential hazards, which could be throw rugs, um, not having rails at home when they need it, and then also a safety assessment scale to evaluate the dangers incurred by people with memory and cognitive deficits that live by themselves. We want to make sure that hazards to healthcare workers, back injuries, you're using assistive devices to make sure you don't get a back injury, you're doing your standing positions correct, needle stick injuries, radiation injuries. You want to make sure that any patient that has an implant, a radiation implant, that you are limiting your time in the patient room. So make sure that you're going in, you're being organized, you're doing everything that you can, and then getting out, so you're not spending a lot of time in a room with radiation. And then also there's violence that can happen to healthcare workers. For assessing for violence, you want to look at the factors that increase the risk for aggression. So your mental disorders, anybody that is intoxicated, people going through withdrawals, have a history, anyone that's high fever, epilepsy, head trauma, hypoglycemia, they can. And what you want to assess for is agitation and restlessness. Yeah, see them pacing, talking loudly, speaking rapidly, any gesturing wildly, or just be alert for verbal aggressions like threats, sarcasms, swearing. It kind of shows that they're intensifying. For crisis prevention, we want to provide undivided attention, respect their personal space, don't be judgmental, focus on feelings, allow silence, clarify any messages that you're getting, develop a plan, and try and use a team approach as much. Interventions related to safety, assess and reassess. Always be checking their physical and cognitive function, any type of past behavior, continually monitor their environment, remove any hazards, provide emergency numbers, make sure to modify the equipment or the environment, teach safety measures, file any incident or injury report, and empower patients to be part of their care. We have different types of healthcare errors. We have treatment errors, which can occur in performance of an operation, procedure, or test, when administering a treatment, in the dose or method of administering a drug, or in avoidable delay in treatment or responding to a normal abnormal test. We can have communication errors, which occurs from a failure to be able to communicate, diagnostic errors, which is a result of delay in diagnosis, failure to employ indicated tests, use of outmoded tests, or failure to act on results of monitoring or testing. And then lastly, there's preventive errors, which occurs when there's inadequate monitoring or failure to provide prophylactic treatment or a follow-up treatment. We have our 7 rights of medication administration. So we have right patient, right medication, right time, right dose, right education, right documentation, and right route. For the test, you should review what information do you need to know regarding the safest method of transporting a patient, what are the methods of assessing clients at a risk for injury. For a fire, know the orders as to what you should do on the hospital floor. What are signs and symptoms related to immobility? Why do CNS depressants contribute to risk of falls? And then what are some of those CNS depressants? And then know what are the aspects that contribute to a culture of safety. Nursing assessments, we want to make sure actions that you get you more data. You want to see, hear, smell, feel. So make sure that we're inspecting, palpating, um, auscultating. The more data that we can get, the better our assessment will be. For nursing diagnosis, it needs to be problem focused, health promotion or wellness, or it needs to be a risk for. Problem focused is 3 parts. So you have the diagnosis, you have the cause and etiologies, which is you're related to, and then your manifestations, what you observe that proves the diagnosis is appropriate for this patient now. So as evidence based. So the example, stress overload related to new complex medication regimen and responsibilities at work and home. Um, and evidence based is the patient is shouting. Your risk for they have 2 parts, diagnosis and then the etiology. So what it's related to, and it has to be applicable to that patient. So risk for falls related to left-sided weakness and dizziness. Secondary to orthostatic hypertension would be one that you could use. And then, as before, remember that the intervention is what you, the nurse, are going to do to help facilitate the patient's goal. Interventions do not get you more data. You already have gathered that data, and you want to make sure it's smart. So it is specific, measurable, attainable, realistic, and then a time frame. So you're going to have the outcome and the planning is the goal, what you want the patient to accomplish related to your nursing diagnosis. Um, so you want it worded like the patient will. You want to contain how many by when. Interventions are what you are going to do to help do it. And then the outcome would be, did it work?